All right. I'm operating this myself, so I'm going to be kind of opening the door here as I'm doing this presentation, but let's get started. Go away. All right, can you see this first slide of my PowerPoint? Excellent. Okay, that's fine, Candace. All right, I'm going to go ahead and get started since we're going to be recording this and putting it on the website. Hello everyone, welcome. This is our CY 2024 stub year mental health opioid remediation grants information session. Today's May 1st, so those of you who spend the month of May with green ribbons everywhere know this is Mental Health Awareness Month. And so there's no better time to launch these 2 additional grant opportunities from the city of Naperville. This information session is being recorded. It will be posted on the website after the presentation. So today, did I say I'm Miranda Barfuss, Community Grants Coordinator? I think I know everyone here, but if not, I hope to meet you soon as well. Today, there we go. Today, I'm going to go over the 2 new grant opportunities. First, I'll give you background on what we're calling this CY 2024 stub year. Then I'll discuss both grants, the application forms, the evaluation criteria, submittal of your application, due dates, and at the end, I can answer any questions you have. All right, so the CY 2024 stub year. Stub year is a term we originated here at the city a number of years ago when there was a conversion from our fiscal year to a calendar year. And that resulted in an abbreviated grant funding year. So it's basically our term for that, a short funding year. The reason we have these grants available is because during the city's budget approval process at the end of 2023, the City Council approved an additional $250,000 in social service grant funding specifically for mental health. Social service grants address mental health, but the social service grant allocations for 2024 had already been approved when the funding was allocated. So this funding has necessitated having its own separate grant cycle. Simultaneously, as a result of a national opioid lawsuit, you probably heard about in the news, that was brought about by state and local governments, the city began receiving opioid settlement payments last year. The police department has been receiving them. We anticipate receiving annual payments totaling more than $650,000 through 2038. So these funds must be used for substance abuse response and prevention efforts. The police department expends some of these funds for opioid remediation efforts, but majority they cannot spend. So we are also giving that away in grant funding to make a bigger impact on our community. So the partial grant funding year, the stub year, is June 2024 through December 2024. A couple of unique things about these grants that differs from other City of Naperville grants that you may be familiar with. I think most of you are applicants to some of our other grants. One, the requirement that awardees must be registered 501c3 organizations has been removed for this grant cycle. This is so that medical providers, coalitions, school districts, and other entities can apply for and be awarded funds as well. Secondly, we've ended our use of the Blackbaud Gifts Online grant system. So if you've applied for City of Naperville grants in recent years, you know you submitted your application online through the portal. And due to cost, we've just ended that contract and we're converting to an in-house system for all of our grant applications. This means that you're applying for this grant and future grants using fillable Word forms and submitting them via email. This is the first time we're doing it, but you can expect this for all the grant applications going forward. They may change to fillable PDFs or other formats, but they won't be going through the online portal anymore. It just cost us too much of our valuable funding to maintain that system. Another update for this grant round, community services department staff are reviewing the applications. In the past, we've used members of our commissions and our community's task forces for grant review. But due to our really short timeline, we have to review applications and recommend funding. This time we're handling the process in-house and using community services department staff for review. It's all going to be done in a week. Finally, I just wanted to note that the regular social service grant, community development block grant, and SECA grant cycles will be starting up again this fall. You can look for that in about September. So you'll be applying for next cycle while this stub year is still occurring, but that's kind of normal from grant cycle to grant cycle. The opioid grant opportunity will also become an annual thing as long as we have settlement funds to award. So it's planned to become a part of the regular social service grant cycle. All right, first I'll just go quickly over the mental health programs and services grant. So the additional mental health funding has been added to the social service grant funding pool, which means it comes from the city's food and beverage tax revenue. It's our money generated in Naperville and then awarded in grants to benefit Naperville. There's no outside funding entity involved. Again, the 501c3 requirement has been removed for this cycle. 501c3s are encouraged to apply, as are school districts, medical providers, coalitions, and other entities. If you have already received social service grant funding this year, that's fine too. You are eligible to apply for additional funding with this cycle. Your program must impact mental health and Naperville residents. This can include prevention, early intervention, counseling, suicide prevention, crisis care, and more. You just need to demonstrate in your application an impact in the area of mental health and Naperville residents. These grants, as with all other city grants, are reimbursement grants. You will incur costs first and then submit a request for payment form and documentation to us to receive your grant payments. You can request it all in one chunk or as you're going. Doesn't matter as long as it's on a reimbursement basis. The request for payment form and the final grant report form will be virtually identical to the social service grant forms, and they'll be posted on the website and issued to awardees. They're not there now, but they will be. The grant is program-based. Organizations can submit multiple applications if you have multiple eligible programs you're seeking funding for. Each application will be scored separately. The total funding available is $250,000, as I said. One organization asked me about an average grant size. We do not have an average grant size predetermined because we don't know how many applications and what kind of applications we will be receiving. However, this is a stub year, so there's really only like 6 months of this year to expend the funds. So be sure you keep that in mind when you're making your requests. Next, I'll just highlight the opioid remediation grants. This funding, as I mentioned, is from that national multi-state opioid settlement. So programs and services have to qualify as an approved abatement program and impact Naperville residents. Approved abatement programs are pretty wide. It's a pretty wide category, which is good. They can include anything from public education about substance use to treatment centers, to medication-assisted treatment, wraparound services, school-based and youth-focused education programs. There's a lot that will fit the criteria. So what we have done is put Exhibit B of the Illinois Opioid Allocation Agreement on the website for you so that you can review it in entirety. It's about a 15-page document of all kinds of abatement programs and uses. So hopefully you can find a fit for your project. Water. And then please address the fit in your application. Reviewers will review this, but the better you can show that your program qualifies as an approved abatement program, the better for the review team and the prospects of you getting funded. Just spell it out for us and be clear. That's always appreciated. Again, this is a reimbursement grant. same as the other. You'll incur costs first and submit requests for payment. Again, if you have multiple programs you want to submit separate applications for, you can do that. And the total funding available this year is $100,000. And yes, as I said, this will be an annual grant opportunity going forward. It's our intention to award these opioid remediation grants each year through the duration of this, that we have settlement payments being received, which are estimated through 2038, as I said before. All right. The application. The rest of this presentation is going to address both grants at the same time because they're very, very similar from here on out. It's nothing different. Very similar applications, similar review criteria, and the deadline submittal are all the same. So both applications are fillable Word forms. There's no word limit set on the fillable fields, and we hope you don't run into any weird formatting issues. We've kept them very, very simple. Come on in. All right. We've kept them very simple. If you do run into formatting concerns, let me know, because these forms are a basic prototype of the other City of Naperville grant application forms to come. This is kind of a test process for converting all our grants to an in-house system. So, you know, I imagine in the fall, these forms may be much prettier. They may have word limits and required fields. And they may be fillable PDFs, but for right now, we're using pretty basic fillable Word forms. The application sections are the same as they've been for social service grants in the past. So we ask for your organization's general information, the details of your project, what are the objectives, how will it benefit Naperville residents, who's the target population, what impact do you hope to have, what is your organization capacity, have you managed other grant-funded projects before, what's your organization's experience, how will you document outcomes. If you've applied for SSG funding before, these questions will not look new to you at all. So that's all covered in sections 1 through 3. In section 4, project costs, you will need to complete a project budget form and a source of funds form. These are Excel forms, and they are the same as we've used for social service and CDBG grant applications in the past. So be sure you complete and submit those with your application attachments. Section 5 is attachments. In the application, I should note, the application forms I sent out to folks on Friday, this section had a typo. It was labeled section 6. We went right from section 4 to section 6. But now we fixed that very annoying little typo. So use the forms that are currently on the website, please. The attachments required include the project budget form and the source of funds form. We also want background and overview of your organization, copy of your audit, 501c3 documentation, if applicable, again, not required, copy of your articles of incorporation or certificate of good standing. If you're a very non-traditional organization that doesn't have these things, just contact me to discuss it. We will. That's fine. We want a list of your board members with affiliations if you have a board, and then we invite you to attach anything else you feel is important to your application. Don't drown us in material, but if you have important things you want us to see and consider, go ahead and attach it. Evaluation criteria is the same as for the social service grant fund. The same weighted scores into different categories. Staff reviewers will read your application and assign a score to each area based on their review. Then the application's total score will be compiled with the other reviewers to generate an average score for your application, which is measured against the application scores for other applications. This is a competitive grant process, just like every other one we have. So I have put this here. This is including the verbatim descriptions reviewers will be using to score your application. I give you this so you can submit, the best application that you can. Timeline. Today's May 1st. Here we are. Applications are available on the website. And I just want to make sure I'm not missing anything. Yes, please. Yes. I'm sorry. I will address questions at the end, but Bill asked if they submitted all of this with SSG in last fall. Do they need to submit it again? Yes, please, because we don't have time to go get it from the other applications. Please submit it all fresh. All right, timeline. Obviously they're due May 31st, 2024 by 5 p.m. The applications will be reviewed, scored, and allocated funding in 1 week's time. Like I said, lickety split, woo, and submitted for city council approval. The agenda item for approval on these allocations will be on the June 18th, 2024 city council meeting. So city council agendas are always published on the Wednesday prior to the meeting date. So you can take a peek. City council meeting's a public meeting. You're welcome to attend, but you do not have to. As soon as allocations are approved by city council, I will be sending awardees a grant agreement to sign and return to me to have executed, and then we are off and running. The close of the funding year, as I said, is December 31st, 2024. All of your funds, if you want them, need to be requested and processed before that date. Our finance department does give us a little bit of grace and leeway in January to finish things up, but don't count on it. They're very mean. No, I'm just kidding. The funds need to be expended this year. And you probably want it in your bank account too. Then I just have the website link on there again. Switch. Bill's asking if we didn't get full funding from the SSG grant, can we request the remaining unfunded portion for the stub grant? Absolutely. Yes, you can. Yes, you can. To submit your application, this is simple. Email it to me. I recommend using a zip file just to ensure your email goes through, but if you run into a situation where your files are too large to email, contact me and we can Dropbox or work something out. I'll send you confirmation of receipt of your application. I want you to be assured your files were received. Because I'm not an automated system, but I want you to know. So I will send an email confirmation back to everyone. If you don't get a confirmation from me, please check in with me. I don't want to miss anybody. Just a couple reminders again. Applications are due May 31st. You know, we'd rather give you guys the time to do your application than for us than the reviewer time. So that's why we're giving you the month. Don't forget to complete the project budget form and the source of funds form. Please ensure your application's complete when you send it. Remember, we're on a shortened sub year, and you only have until December 31st, 2024 to expend your grant award. Here's the website again, where all the application materials can be found. And as always, throughout the process and throughout the year, you can contact me with any questions you have. So I'll now take any questions you have in mind right now. You're also welcome to email me or contact me after the meeting if it's something specific to you. I'll look at the chat, and then also there's not too many of us here, so you can go ahead and speak out loud, but let's look at the chat. Is there a place to put what percentage of Naperville residents are being served by the program? Yes. Yes, I believe the application has that in there. Section 2, question 3 is the Naperville impact. Provide the percentage of Naperville residents. Yes. You can edit and save and come back. You'll download the application to your form and do whatever you want with it, as long as you send it to me complete at the end. Does anybody else have any other questions while we're all together?
I do.
Sure.
Do you have a preference between direct service and technology? So if we wanted to do something in terms of technology, would that be looked at well, or would you prefer a direct service grant?
I think that we would prioritize direct service. That tends to be how it goes.
Okay.
But if you want to talk to me about it specifically, okay. I'd be interested to know
what I'm really talking about.
Right? Yeah. I'm curious.
That's a long thing that everybody needs to listen to, but you okay, sounds great. Thank you.
Absolutely. Anybody else have any questions right now?
I don't have a question, but I kind of just have a comment off of what was just said, because just working with college students, technology is like the main way that they communicate and receive information. So sure. I would love to know the answer to that too, because they're less and less doing direct face-to-face kind of
It's still direct service. Yeah, okay. I see what
Yeah.
you're saying. Mm-hmm.
I mean, I don't even mean that telehealth, but I just mean even for health promotion or to get their attention,
Mm-hmm.
they will only really look at their phone and through social media or through texting. So
Yeah.
I am curious about that, if there would be a way to, because I think that's we're finding that is the number one way to meet the younger population. And so I don't know if that applies to anybody else, but I would love to know if that could be supported too.
Yeah, I mean, what I'm referring to is more of like a database management type of a system.
Gotcha, not health promotion. I see.
Yeah, exactly. So that we make sure that the um, clients are being served correctly and well.
I see. Gotcha.
Okay. Yeah, and I think what you're speaking about is ways of reaching the youth. The technology is certainly a great
Yeah,
way
it's
to
a
go.
you know.
All right, if anyone, oh, here's another chat question. Oh, just a thank you for Bill. Well, you're welcome. I'm excited about this. I've been anxious about it since I knew that it was here because I really want, I mean, I'm like, oh, they don't have any money to spend, they don't have any time to spend their grants, but thankfully it's out here. It's good for Mental Health Awareness Month, and we'll get this approved and get you your funding as soon as we can.
Terrific.
All right, contact me with any other questions you have. Thanks for joining me. You know, I like in-person sessions, but I didn't think we had time. So hope to see you all soon.
Thank you.
Thank you.
Thanks.